Hello, dear listeners. From today onward, I'm going to start a new series of podcast in which I will discuss some cases, skin-related cases. I will be more focusing on cases involving children, as they often do not express mental or emotional symptoms. Therefore, addressing these symptoms are mostly quite challenging in practice. I will share various cases where I have used different homeopathic approaches. Through this, you will discover that there isn't just one way to approach or solve the case. Rather, there are multiple approaches that can be beneficial in practice. So I use these different approaches in my practice to solve the case. I mainly deal with the chronic cases in my practice, which involve children who have already tried different homeopathic remedies or allopathic treatment, including steroids or immunosuppressant drug. I prefer not to dive too much into philosophy or explanation at this moment. So let's begin with the case, and I will explain how I manage those cases through examples. Perhaps I will create more videos on this topic, in those different approaches. In each video, I will share different approach to handle such cases. So let's start with the case. This is the case of a 1-year-old boy. He suddenly developed a skin issue on different parts of his body. He had red rashes and itchy all over his body. Even his skin became inflamed in various places. These skin issues started from his right underarm and moved to his hands, and now they have spread all over his body. His skin was extremely dry, so the doctor has given him some creams for dryness and cortisol cream to treat the rashes. He also got an antihistamine syrup because nothing was helping, so he cannot sleep because of the extreme itch. The child keeps crying whole night and scratches his body until it bleeds. But still, it doesn't help him in any way, nor antihistamine was helping. Mostly, he falls asleep when he's tired of crying and wakes up quite early. Mostly, he sleeps around 3-4 o'clock because of the tiredness, but then after 1 hour or half an hour he wake up again and start crying and itchy. His mother and father were in total exhausted state because they cannot sleep or take a proper rest. Generally in the morning time, child is happy, or when he's not getting itch he's happy, but when he get this itchy skin, he start crying, and there was no sign of aggression or anger in him. His mother told me that his itch got worse in the evening, especially when we try to change his clothes, because we need to put cream on his dry skin, and his skin bleeds because of scratching. So this is a kind of a dilemma. And she also told me that he is mostly itchy on his covered body parts, which is very specific to the remedy which I have given him. And his mother told me that his rashes on his face are like a round shape. Keep in mind, there are a few remedies which has this very specific skin issues, like this round shape or this circle kind of skin lesions. One of the top remedies are tellurium, and then there is a tuberculinum and psychotico. These are the top remedies which has this specific, this ring kind of skin lesions. And she also told me that giving a bath to him is also difficult because it aggravates his skin issues, especially the itchy and dryness. That's why he doesn't enjoy bathing at all. The history of a child was that in January, he was admitted to the hospital because he had bronchitis, which got worse and he developed some serious conditions. So he ended up in the emergency room. There he was given antibiotics because his lung condition was quite bad. But after this treatment, he felt better in the few days. However, around February, he developed these skin conditions. Here I asked the mother what happened around that period when he develops this skin condition. She said, nothing, it suddenly pops up. So here is the point. So there was no such cause which actually triggered that skin condition except that bronchitis phase or his phase in the hospital. Here I also asked them about his vaccine. She said it was just 1 month ago, and after the vaccine he developed fever and flu-like symptoms. For this she gave him paracetamol. Then I asked her, what do you think that these skin conditions develop after the vaccine or if they were already present before? She said no, he has already suffering from skin issues before he received this vaccine. He got this MMR, pneumococcal vaccine, and meningitis vaccine. So pregnancy, his history was normal. There was no complications. Everything was fine. So let's come to the analysis. Now, I have given him Thuja 200 immediately after the consult, and in the evening, Nux vomica 200, just 1 dose. Now, the question is why? Remember, Thuja is famous in our homeopathic literature to subside the side effects or bad effect of vaccines. In my practice, I often use Thuja for this purpose. I also use Thuja in those children's cases where I do not find any cause of the origin of the condition. Here I have not prescribed any remedy made from vaccine or nosode like MMR or pneumococcal because I do not see any such behavior changes in him after the vaccine. And why I have given him Nux vomica? Because Nux vomica is the remedy to antidote the effects of painkiller like paracetamol or ibuprofen. Next morning, the mother texted me that the reaction was instant. The patient slept well and quickly, and there was no itchy at all, not even when we tried to change his clothes. Further that night, he didn't need any antihistamine at all. Next night, so next evening, he hasn't slept again because of the itch. His day was okay, but night has been bad again. His mother gave him antihistamine syrup around 3 o'clock, and which has no effect on him. Now, here comes the trick. What do you do in those cases where this situation arises? I know on the first day that Thuja or Nux vomica is not his summilimum. And now if I repeat Nux vomica or Thuja at this spot, they will definitely not produce any effect. Or if I give them again this Thuja or Nux vomica, this would have spoiled the whole case. Then question is why I have given him these two remedies. The answer is both remedies made clear the way for the summilimum or indicated remedy, because Hahnemann said remove the hurdles in which are in the way of cure. In other way, remove miasmatic layer first, then your remedies start working. So Thuja and Nux vomica had removed that layer or a kind of a block which helped next remedy to work. So Thuja and Nux vomica had removed that layer or that miasmatic layer or the block which will helpful for the indicated remedy to work. Remember, nowadays patients come with multiple layers of diseases or conditions. But mostly we do not get the clear picture or the symptoms of the case. In that condition, you need an approach which can remove those hurdles which are blocking the way of healing. So at this stage, I prescribe him a Rumex, which was his indicated remedy. I gave him Rumex 30 3 times a day for 2 days and then just once a day for a week. Why Rumex? Because Rumex has this specific skin condition. Its skin condition got worse or aggravate when there is a change in the temperature, such as undressing, which is a very typical symptom of Rumex. Its skin condition got worse when it exposed to the cold air or when undressing. It is a great remedy mentioned in Materia Medica under the cough or skin related issue like urticaria or rashes. Rumex is an acute remedy for cough as well. It is used especially in winter conditions. It's cough aggravated by cold exposure or weather changes or even eating as well. That's why you will see its patient avoid breathing directly in open air, because inhaling cold air also aggravates his condition. So mostly you see them, they come to your practice by wrapping them, up, or cover their mouths to avoid direct contact to the cold air. So they just put the shawl or the something on their mouth to cover the cold air. I will talk in more details about Rumex in some other video. In fact, I will share its whole family, Polygonalis, but I will also share some more skin related cases in children, because these cases are difficult to handle. Dear listeners, this was today's talk. I will share more cases in upcoming videos. See you next time with the new video. Bye.